What I'm going to do tonight is talk about some of the medical evidence from UFO abduction encounters. Now, the thing here about some of the cases I'm going to tell you about is that we have not really adequately investigated them. Some we have and some we haven't. One of the problems is that we need profound expertise, medical expertise, to help us with these experiences, to try to find out exactly what may lie behind them. If there are any doctors, dentists, urologists, gynecologists, internists, whatever, sitting out here, let's talk afterwards, because we really need this kind of help. I wish that we had more precise evidence to back these things up. But what I'm going to show you are situations where there's already a medical mystery behind the situations in which many of these people find themselves after abduction experiences. I also want to point out that medical issues of some sort, some of which are rather grave, as you will learn, these are thankfully very, very rare. Just as you occasionally hear about a healing that takes place during an abduction, you sometimes hear about these cases where there is some kind of medical problem that can be of a serious nature. But they're all, thank goodness, marginal. One of the things that's really interesting about this is that you will see some physical evidence, marks and so forth, and we'll go into some of these cases in depth. But as an example of the way people tend to dismiss this subject, a man once said to me, and I love the quote, he said, how can you go along with this sort of stuff? It's just a cult. You people are in a cult. And I said, well, it's very interesting that you bring that up, because it's the precise opposite of a cult. We have these physical marks, which you're going to see, which are repeated again and again and again in many, many hundreds of people. You're going to see scoop marks, cuts. You're going to find out issues about a disappearing ovary. You're going to find out many, many, many things which we do not know the purpose of. We have to explain. We don't know why these things are inflicted on people. We have some theories, but we don't really know. And I'm the first to say I don't know. But at any rate, we've got all of this physical evidence about which we have no clear, absolute idea of its purpose. And I said, the interesting thing to me is a cult, like, let's say, the Moonies, is a situation of all beliefs and no miracles. It's all an elaborate set of beliefs that you have to have about who the Mr. Mooney is himself, or whatever the term is, and what the theology is and so forth, but there are really no miracles. And we're in exactly the opposite situation. We have all these miracles, and we have no theory. We have no theology, so to speak, of why these things are done. We have some ideas, some speculations, but we really don't know. So if you're in a situation where you have to judge between all beliefs and no miracles, or all miracles and no beliefs, I'm interested in the latter case, because those are things that create genuine mysteries. Now, I want to start with the first slide. We can turn on the slides. I don't know whether I do it from here. Okay. It's a little hard for me to see with the light. All right. I'm going to deal first with something that many of you people are very familiar with, which are the so-called scoop marks. This doesn't happen to every abductee, or maybe even 1 in 20. We don't really know. But many people, when they're taken, find themselves afterwards with a little depression, often in the front of the leg. They can appear in many different places. I've even seen them on the face. They can be very small. They can be very large. But it's as if a layer of cells has just simply been scooped out. They do not remember bleeding. They do not remember any kind of pain, for the most part. They just suddenly find themselves with this mark, and there it is. And they have no idea what caused it. Now, this first slide shows Kathy Davis, I reproduced it a long time ago when I first got into the idea that these events were happening, these scoop marks are being made. This is in my book Intruders. This is very difficult for me to see from here. Oh, here we go. This is what it looks like up close. Now you can see the same thing on her leg. This is in the front of the shin. There's a little oval depression, and this is something she'd had on her leg for a long time. This is her mother's leg. She has one in exactly the same spot. And very often, for instance, in one case, 3 different young women were in an automobile which was stopped. There was an abduction, and all 3 young women had scoop marks on their right ankles immediately after the event. We're not sure why. This is her mother's scoop mark seen up close. This is one that you can see also in the same spot on the front of the lower leg. You don't see these very often. This isn't quite healed. But the point is there's no healing really that seems to be necessary, really extensively. The person is returned. It can be a baby, and the baby is returned. The mother takes the little Dr. Denton's off the baby, and there are these marks. And nobody knows why, but we can certainly know for sure that a layer of cells has been removed from that child. Now this mark, which is perfectly circular, is on a little boy, 5 years old. And the interesting thing here is that his father had taken him to the doctor because he had a rash on his leg. And the doctor said, here's some salve and so on and so forth. Come back in 4 or 5 days and we'll look at it again. He came back 4 or 5 days later, and there was this scoop mark on the leg which the father had noticed that had occurred in the intervening 5 days, but it was totally healed. The doctor had no idea how it could have gotten there. He'd just seen it for the first time 5 days before. This is a very rapid situation. This is a very small scoop mark at the front of the leg. We're going to go through this fairly quickly. Now, these particular marks are close-ups, and you can see what happens, that the oval quality of these things suggests a certain kind of tool, and many people remember a small, almost like an ice cream scoop or something that slips in, although many people can't quite see it, because if they're lying horizontally on a table when this is done to them, they can't really raise their head enough to see what's going on down there. But again and again, the same thing happens. Now, in these 2 pictures, the top one, which is a very large scoop mark, is on the right thigh, the outside of the thigh of a man. This occurred actually in Turkey. And he has one on the other leg in exactly the same spot, a symmetrical set. These are things which he noticed when he was a child, has no idea how they got there. His parents don't remember. There was no blood. There was no anything. The one at the bottom is very interesting because this is on the shin, the front, the shin of the lower leg of Peter Curry. Now, I don't know whether you're familiar with the Peter Curry case. I was just in Australia, and it's an extremely important case. Peter Curry was an abductee. He's of Lebanese background, living in Australia. And in this case, which is now quite well known, he was awakened. He's been through a lot of other experiences. He was awakened, and there were 2 females in the room with him, one sitting on him, a very strange-looking woman with hair that didn't quite look human. And he was totally frightened, and she pulled him up towards her. He pushed her back as best he could. He found her incredibly strong. The other woman he thought was observing to see what this connection was going to be, perhaps sexual, we didn't know. Ultimately, when this thing ended, when he didn't remember what happened next, he woke up later and there was a hair, a long blonde hair, which was he found in a fairly embarrassing place in his body. The hair has been analyzed. There is a Nobelist in Australia who does work with genetics and studying the DNA of this hair, and it is extremely unusual. But at any rate, that mark on Peter's leg comes from a totally different experience. And there's one little detail about the experience when this apparently turned up that I find very touching, very real, very bizarre. He showed me in his house where at the foot of the bed there's about a 10-foot space, and then there are these long folding doors which have the closet which have mirrored surfaces. He remembered at one point waking up, being lifted off the bed. Small figures were coming towards him through the mirror. And he thought there are lots of them until he realized he was looking at them from the front and seeing their reflections in the mirror, which doubled the number of aliens in the room. He remembered being floated towards this mirror. That's that ability to float people through, however this is done, we have no idea, through a closed surface. And he said he remembers as he was getting closer to the mirror, his head was up just a little bit, and he could see this terrifying face staring at him, and realized it was his face in the mirror as he was going through it. And he said as he passed through the glass, he felt as if he was going through some kind of gelatinous substance. Sometimes people describe this sort of thing when they pass through a surface, sometimes they don't. I know all this sounds totally impossible, but we get this again and again and again. Now, this particular case, and I'll just go through this rather quickly, and then we're going to get into some of the more imposing and more upsetting medical cases. This scar is on a man's back, as you can see. The man is an artist, an acquaintance of mine. He's an African American. And the story of this is in itself very interesting. He came to my house once. I'll make this brief. He came to my house once and on an art issue. And he said, you know, but I think I saw you on television the other night. And my heart sank because I wanted to keep this on an art level. And he said, what is it that you do? And I sort of muttered something about UFO research. And how do you know this happens, he said. And I said, well, there are marks, there are cuts, and so. And he said, well, I had this strange cut. And I said, how did you get this cut? And he said, well, that's the thing, I don't know. I was a little boy. I was about 10, and I was on my bicycle. I went into the park near his house in the Middle West. And he said, I don't know what happened, but I remember it was daytime. I remember I was in a big white space, a big white room. I don't know where it was, and I was lying down. That's all I remember. The next thing, I was walking my bicycle home. I got home very late for dinner. My grandmother yelled at me and so on. And she looked at my back at some point, and he said she found a couple of drops of blood on his T-shirt. Now, when you look at this cut, it's about that long. A couple of drops of blood just is extraordinary. And she said, you've cut yourself. It's a terrible cut. How did this happen? And he said to her, and he said this to me, I told her I cut myself when I fell off my bicycle. But when I said that, I was thinking, I don't remember falling off my bicycle. There was no tear in the shirt. There was no dirt on him. The bicycle was fine. And that was the end of that. It healed, and he's had that thing for 40-some years. Now, he said that the situation tormented him, and he would go back to this park again and again and again, trying to find the white place where he was. He made no connection with UFOs. And actually, when we finally began to think maybe something happened here, and I interviewed him at some length, and a few days later, weeks later, we did hypnosis, and he remembered that he was taken from this park into the craft, put on a table, and cut. He said that afterwards he was stunned and so on and so forth. And his wife said, thank goodness we know what happened. Now we won't have to go back to that damn park every time we go back to his hometown looking for that white room. He didn't know. Now this particular cut, again, and as I say, we'll go through these fairly quickly. This is a woman who has had a number of experiences. When this photograph was taken, she had gone to bed. She had a friend visiting. She woke up in the middle of the night. She had a recollection of hands pushing her down. That's all she could remember. And then she came to herself and was back in bed. And her friend noticed this in the morning on her back. And she had no idea how this had happened. Now, what you're seeing in this is a dark bruise, but then down the middle is a straight line cut. She had no idea what happened. There was no blood anywhere, none on her nightgown, none on the floor, none on where she remembered being pushed down, none on the sheets or anything. She went to a doctor. That photograph was taken 2 days afterwards, as I said, when she was taken to the doctor, and the doctor asked her what kind of surgery she had had. And she said, I didn't have any surgery, I just woke up and there it was. And he said, no, that's a surgical cut. What happened? Now, again, in Australia, and this is a worldwide phenomenon, we've already visited in terms of scoop marks and cuts and so forth, Turkey, and now this is Australia again. And I should point out that the basic kinds of marks that we find, even though there's sets of bruises, people find fingerprints and hand marks which fade away and so on after these experiences, so there's nothing terribly mysterious about them. But in terms of these long-lasting things, they're either the round scoop mark, oval scoop mark, or a straight line cut. Now, in this particular case, this woman has a long cut with a kind of a dimple in it. This is something that happened to her. She's a nurse in Australia when she was a tiny baby and in the hospital. And when she was taken home, it was there on her leg, and her parents didn't know what to make of it and never raised any questions. She has a whole history of experiences. In many of these cases, I have to say, the person remembers something about the circumstances of the night or the time that these things turned up on their body, and very often they don't. They just notice it. And in one case with a scoop mark, a man told me he was about 16 when he noticed this round scoop mark on his leg. It's not one of the things I have a photograph of. And he said he stared at it and stared at it and stared at it, and it so terrified him that he said he never wanted anybody to ever see it. He would wear long pants instead of shorts. He didn't know why he was hiding it, but he knew there was something dreadful about this mark on him. It took years and years before, the patterns became a little clearer to him, and he began to putting things together. Now, a close-up of this shows it's quite disfiguring, it's quite deep. I have a photograph which is extremely similar of a woman from Great Britain who has the same kind of mark at the same place on her thigh. Now, again, I want to reiterate, we do not know why they do this. We do not know why they want this level of flesh, but these are permanent marks that baffle the doctors. When we dealt with those scoop marks at the beginning, one doctor who looked at them said to me, they look like the marks you get from a punch biopsy. Did this person ever have a punch biopsy? And I said, no, these are people who had no idea how they got these things. When some of these cuts are there, they seem quite dramatic. People will say, does the person remember how they got cut, how this thing turned up? No, they don't. They don't even remember often how it happens. And I mentioned this one incident that I find very interesting. In England, I was giving a talk, and I'm showing some slides about this, and a woman came up to me afterwards, and she was a woman in her 60s. She was the wife of a police inspector, a very respectable English woman, and she had remembered some conscious abduction experiences. And she actually was a speaker at this very small conference many years ago in Leeds. And she said, Bud, when you show those pictures of scoop marks, I have one of those on my thigh, more or less in the same place, on the right thigh. And except this was a scoop mark rather than that straight line kind of thing. She hiked up her skirts. I didn't ask her to, but that's what happened. And there was this very large scoop mark, size of my thumbnail, of a certain depth. And I said, and it was actually a rather ugly thing. It's the kind of thing that this woman has never been in a bathing suit with friends where somebody didn't say, what happened to your leg? I mean, these aren't just little brushes with some kind of a briar someplace. These are really very clear and very precise. I said, how did you get this? And she said, well, I know how I got it. I was out in the garden gardening, and she said, an earwig ran up my leg and bit me. Now, if you remember what an earwig is, it's a beetle-like thing, and it has pinchers on the back. And I said, I didn't know that earwigs bit people. And she said, I didn't either. I said, must have hurt. Oh, no, I didn't feel anything. And I said, oh, you didn't feel anything? No. And I said, well, it must have really bled. That's a big piece of flesh you lost there. She said, oh, no, it didn't bleed. And I said, did you kill the earwig? And she said, no, I don't remember ever seeing the earwig. And I said, well, how do you know an earwig ran up your leg? And she said, I've always thought there was, and then she said, this isn't making any sense, is it? And I said, no, it isn't. And that's very typical of UFO experiences, where people convince themselves that some outrageous thing is perfectly natural, most typical thing that could ever happen. And yet when they begin to examine it, just as an example, this is a digression. A woman told me that she remembered waking up and she was falling. She said this happened in her bedroom. She was falling onto a chair about 7 or 8 feet from her bed. And she sort of hurt herself when she fell. And she fell from a certain height. And that was an odd thing, she said. And I said, well, how did you happen to be falling on this chair? And she said, well, I figured it out. I figured that I must have been walking in my sleep, even though it turns out she never had been before. I must have gotten up on the bed and stood there. I must have taken this huge leap. I must have caught my feet in the blankets, which made them go up, and then I woke up and fell. I said, you know, that's a kind of a strange scenario. I don't know that that works. And she said, I don't know that it works either. Well, that's what she was made to remember. But at any rate, the thing about this whole procession of marks, and I will show you another straight line cut. This woman happens to be a Native American, and this thing is about that long. It's a very, very long cut. She remembers the circumstances. She was out walking, remembered there was a period of missing time, some confusion, and this perfect cut right down her leg resulted no blood, no anything. And she remembered enough things around it to give us a suggestion that should be looked into. And we did some hypnosis, and out came a surgical procedure, the purpose of which we do not know. Back to the English woman with this earwig bite, so to speak. I said, you know, this is so odd and mysterious. It seems to me that it might be rewarding to look into this a little bit more. And, you know, if we could do a hypnotic session at some point and look back to the day you were out there in the garden and see about this earwig. And she said, oh, no, we don't do hypnosis in England. And what I found out was at that time, Bufora, which is the big British investigatory group, had a bad view of hypnosis, and therefore this woman never found out what happened. But the point is, in these cases, hypnosis can be, as I believe very firmly, can be a very helpful and cathartic method of looking into these experiences. Now, this other mark is on the back of the leg. This is one of the earliest marks that I discovered, and this is something I reproduced in Missing Time many years ago. It was a case from the 70s. Actually, I was dealing with a woman in the 70s, but it goes back even further. She went off into the woods as a little girl, and when she came out of the woods at a picnic with the family had been searching for her for a couple of hours, calling her name. All she could remember is that she'd had this wonderful conversation with a deer in the woods, which had these big, soulful eyes, almost human. And she had talked to the deer, and when she came out, she realized her leg had this cut on it. Well, we know a little bit more about that now. The straight line cuts, sometimes they're very small. This is on a woman's knee. But again, the precision of this is very interesting. This is not a torn cut. This is a physical mark which has been there for years and years on her knee, and it is connected with a particular series of recollections about a missing time period, and under hypnosis we found a lot more about it. Now, we'll move on here. Let me move back to this. This is a little hard to see. maybe impossible. I don't know where you are. It's dark, but let me just tell you, it's incredibly graphic. There are 3 aliens actually looking at it, but you can't see that. No, unfortunately, it's a series of straight line cuts across a man's back. Now, what's most interesting is that they're more or less centered. Almost all of them are parallel, and most of them are centered on his spinal column. This is something that happened to him, again, when he was about 13. At the time this occurred, he was in his 40s. He had no idea how he got these things. These cuts were absolutely clear and precise. They look as if he'd been whipped or beaten or something like that, but you would get all kinds of scattered marks. But this is nothing like that. He's had them for a long time. This is just one of the more exceptional odd cases. I'm going to show you now some of the things which are anomalous anomalies, if you want to double the term. This is a mark around the ankle of Kelly Cahill, who's come forward about her experience in abduction in Australia. It's a very interesting case. And there were a number of different people, 6 different people in 3 cars, 5 people in 3 cars. Each one of them, when they stopped in this country area because of this object parked in the field, and they remembered getting out of the 3 cars, they didn't know each other, and walking towards it. There was an abduction, but each one the next day noticed that they had a ring around their ankles, as if there'd been some kind of shackles used. Now that's extremely rare in these cases. So these are truly anomalous anomalies. Now, one of the really interesting early cases, the Michalek case, this is a case that occurred in Falcon Lake, Canada, in 1967. This man was burnt as he approached a landed UFO in the wilds of Canada. And what he found when he was hit by this beam of light and knocked down and ended up finally in the hospital was a grid-like pattern on his body of burns. And these burns were rather severe. And they faded away, but then they came back again. The whole thing was very mysterious. And of course, the skeptics immediately said, well, it's obviously a hoax. This man just got a lot of things and burned himself. The crazy, as if that's the kind of thing you typically do. Incidentally, the case of the woman who had that long cut down her back, one skeptic said it was self-inflicted. If you want to stab yourself, you kind of... But the point is, any kind of explanation will do to make these things go away. Now, these are permanent things. These are not just temporary, casual incidents. But that grid thing is one thing. Here's another grid. This is on a woman's hip. Now, this is a much smaller area, about like so. This woman had an abduction experience in Costa Rica when she was on vacation. And her husband noticed this. She remembered pieces of this experience that happened at night. Again, not a consistent scenario, but she remembered enough to put it all together. When she woke and went in the shower, her husband noticed this on her hip. Now, these marks did not hurt. They were not puncture marks. They weren't burns. They faded away after about 3 weeks. But the regularity of this is most unusual. I have really just one other case where I found somebody who had, in a small area, a kind of grid-like structure like this. Again, why do they do this? We don't know. What is its purpose? What are they learning? What is this about? We don't know. We can theorize. We have the miracles. We don't have the theology. Now, there are many different kinds of things that people have reported. We're going to move into now a different area which has to do with the area of implants. And these are, again, in a medical context. And my friend, Dr. Roger Lear, has worked with many implants in other parts of the body, but we're going to deal with just 2 areas here. In this particular case, and this is a case from the early 80s, a woman I worked with who lived on Staten Island in New York had recalled being taken into a craft, abducted, etc. And on the table was, on one table was a man stretched out. Couldn't seem to move. And she said there was this apparatus coming down from the ceiling. It was, as it were, telescoped. And she said, to her horror, she saw the needle at the end of it go into the corner of the eye, right at the corner of the eye. And she said she could see his body quiver. He couldn't do anything, but it was quivering in reaction to this. Extremely upsetting to her. We have many reports of people who feel that something was inserted through the eye socket. Now, if you want to put something in the skull and not make a hole, the eye socket is one of the places of access. Now, with this idea in mind of this thing going into the head, I just want to show you another drawing. This is drawn by a little child who had had apparently abduction experiences, and he made this drawing for his mother, which showed, as he explained to his mother, he was quite young, as you can see by the drawing, it showed a figure with a very big eye. That was as if he's drawing a profile, big head and huge eye. And on the table was another little child who he knew from the neighborhood. They remembered this little boy. And they were putting something in the child's eye socket. It's very interesting to me when you get a kind of congruity between an adult description of the apparatus and a child coming up with this. He was intensely frightened by this, and his mother said he was extremely frightened for a long, long time about his eyes because of what he had seen. Now, in terms of the basic abduction implant situation, one of the things that I find extremely important is that we have implants which seem to be put in place inside the skull. There's no possibility that something got into the hand or the arm or the leg or the foot or something like that by accident. That's out. This is inside the skull. In this particular case, what you can see towards the top on the left is a small metallic object. I've had these x-rays looked at by a friend of mine who's a neurosurgeon. The story behind this is that a couple were in Italy. The father was in the army stationed in Wiesbaden, Germany, and his wife and little girl had all reported very strange experiences. And the little girl was afraid to sleep in a room at night and talked about monsters coming in through the window and one thing and another. There were various little symptoms that were noticeable that suggested she may have had some kind of experience. At any rate, they went to Italy on this little trip, and the little girl had an accident on her bicycle and fell off the bike and banged her head, was taken to the hospital emergency room, and when the x-ray was done to see if she had any kind of a skull fracture, they noticed this little object. Now, the x-rays are taken one from the top down, one from underneath, and one from the side. So you've seen one of the x-rays. This one, instead of coming down like this, is coming up like this. The object you can see is in the eye socket, just under the eye on the left side. So you can locate where it is laterally, at least. Now, the side view shows it very clearly. And the neurosurgeon said to me, these three-dimensional shots can place this thing directly. And he said to me, "Bud, this is a piece of metal in there of some sort. How did it get there?" And what was most interesting is the emergency room people in Italy, I think this might have even been Milan, were extremely curious about this. When the little girl was taken back to her home, temporary home in Wiesbaden, Germany, she was re-x-rayed and there was nothing there. Now, one thing we know is that this has happened again and again. The x-ray shows something present, and then it's not there anymore. I'm sorry? Okay, I don't have the follow-up films that were taken by the military, no. But they do, and said it wasn't shown. Now, incidentally, in questions like this, do I have this, do I have that? In many cases, we don't. And I suppose in addition to my natural laziness, there is a situation where a lot of this is very hard to obtain. Parents are not too anxious to present this kind of thing. And they want it to go away, essentially. even though the parents did send me these x-rays. Now, this is an x-ray which many of you may have seen. I reproduced it in my book, Intruders, which shows in Linda Cortila's nasal cavity, I'll show you more of a close-up, a small object, which she recalled going in on the end of a needle. She had a scar there, and she remembered it as a round thing, but somehow it's as if it expanded once it was inside her nostril. And once the x-rays were taken, a couple of days later, she woke up bleeding from the right nostril. There was nothing there anymore when we had her re-x-rayed, and there was a little cut where it had been. It's as if they somehow know what happened. Now, in terms of these x-rays, these are very important because these things can't get there by normal means. There's no way you can get something like that in the middle of somebody's head. Up the nose, yes, but not deeper into the skull. I'd like you to see just a report. We have a number of letters and things like that. The doctor writes, "Thank you for your x-rays. You do have a tiny 1 by 2 millimeter radio opaque foreign object in the area of your right," I'm trying to read this, axillary. Anyway, I'm not going to try to read it because it's a little hard and eyesight is a little peculiar. But anyway, we have these letters. We have x-rays in some cases. We have the radiological reports. This is just a letter from a doctor reporting this particular object. Now, I give you another x-ray incident where a woman in, and this is quite interesting, a woman in Salt Lake City had been driving home with her son. She remembered a lot of experiences when I dealt with her later. She had been driving home from a neighbor's house, friends, with her 16-year-old son. She remembered the car stopping in the middle of the night, a lot of light around there, a lot of terror. She didn't know what was going on. And finally, she thought there were people who approached the car in the massive light. The son remembered that he had to move her over and drive the car home because she was in a state of shock. They didn't realize what happened. They didn't connect this with UFOs. At any rate, what happened is years passed, and this woman was babysitting the dog of a friend of theirs, a big dog. And in the house, when she opened up the house to feed the dog jumped up on her with excitement and knocked her back against a brick wall. She hit her head, knocked herself out, fell, woke up with some blood, and she called 911 and was taken to the hospital. And here's the letter that the radiological form. We have the x-rays from this time, but they're on microfiche, so they're very small. It's very hard to see anything from those pictures now. But she said she remembered the x-ray, the radiologist coming down the hall in the emergency room, because the fear was, as I said, a fractured skull, saying, "Your skull is all right, but how did you get that metal in your head?" And the report says, this is the radiological account, consultation form. The hospital listed all the names, which I blacked out. Skull series, fell and hit head. 3 views include brow up, lateral views, AP, and town films. I don't know what that means. Examination demonstrates an oval metallic density in the projected position of the brain of the right parasagittal area. This appearance is unusual for an artifact, and certainly the pattern would be worthy of pursuit. A study of the bony calvarium and scalp shows no evidence of abnormality of the scalp mantle. In other words, there was no break, there was no wound, there was no anything. Impression, 1, RO, metal density, foreign body, right parasagittal area, as noted above. 2, no fracture abnormality is seen. So here we are with what are, in a real sense, medical mysteries. These are not relying upon eyewitness testimony of anything. These people are carrying these things around. A picture of something that was inside their head, marks on their bodies, cuts that seem to be impossible, which conform to patterns of other cuts in other places. We don't get zigzags. We don't get some kind of torn, irregular thing. We get these precise ovals or circular scoop marks or these straight line cuts. We get these objects in the head. This is evidence. This is physical evidence that something happened to these people. This can't be ignored. And this has nothing to do with anybody telling a story about anything. Now, what I'm going to do now is we're going to look at some of these little more bizarre cases, which do turn up. Now, one thing we know, and we simply know this for many, many reasons, people's accounts, and after women have had hysterectomies, there have been very, very strange scarring that turned up in the fallopian tubes or the ovaries. The doctors were puzzled. I have quite a group of statements about that. But at any rate, this is a recent letter. Man said, I have a bit of a problem, and could you help? I never thought I'd be pursuing anything like this. My wife and I just gave birth to a baby boy. You can see him and us at website, etc. Very proud father. My wife had to deliver by emergency C-section, and afterwards the operating doctor came into our room and said, so when did your wife have surgery? It wasn't in her records. I told her, it was a female doctor, this is the first time my wife has ever been in the hospital as a patient. The doctor looked perplexed and asked again, are you sure? Are you sure she's never had any kind of surgery? I replied again, no, we were discussing this on the way over in the car this morning. She wasn't even nervous to be here to deliver the baby. I'm very proud of her. The doctor looked away for a moment, trying to think of how to discuss the subject, so I asked her, what's wrong? Just tell us. The doctor came back with, well, your wife is missing a fallopian tube, an ovary. It looks as if it had been surgically removed. Are you sure she never had surgery? At that moment, now, in this family, as the man pointed out, he's been involved with experiences all his life and has been intrigued by the subject. And although his wife has not been and has not said anything ever happened to her, and she's looked down on. When the wife was still under sedatives, and in a bigger part being married to me, it turns out because of the UFO thing, she replied, yeah, it must be the aliens, and she laughed it off. The doctor replied, yes, aliens? She wasn't happy with the answer. I was shocked by my wife's response, as she's the straight shooter conservative school teacher. I'm the one who's conspiracy theory, metaphysical, and esoteric studying UFOs or something else in the family, or something else person in the family. There's a lot more to this story. A series of events have happened ever since we've been married, electrical and other manifestations which have occurred in the past year, as well as my own history with the subject. The idea of UFOs and little grays have gone back to my childhood, but with her, never until she met me was she really that interested. Now, I've talked to him on the phone, and this is what the doctor said, the obstetrician. She said that she was definitely not born with a missing ovary and fallopian tube, because she said the surrounding cavity in the body was lifted up in a kind of a bulge where the ovary should have been, but it wasn't there anymore. And she is thoroughly puzzled. Now, I'm going to be working with this couple, but it's extremely interesting because I have other cases like this. A man came to me on Cape Cod with his wife, and he had had experiences, and apparently so had she. Now, she did not want to look into this herself, and that's why we were sort of loggerheads. And you have to understand that when something like this turns up in a person's life, they do not say, oh boy, let's look into this, I want to find out. Many people just say, look, let's just forget about it. Let's just get on with our lives. I understand that. It's a perfectly rational way of going about it. But this man said to me, after explaining a few experiences that they had had, he said, my wife had a baby by cesarean section. And a few years later, she had a second baby. And he said, we went to the same OB/GYN, who did the cesarean section the second time, and the doctor said, "When did you have your right ovary taken?" And she said, I haven't. And he said, "Well, you had 2 before, you only have 1 now. When was it taken?" This woman was extremely, extremely upset. And there was nothing she could say. Now, there was no scar externally other than the scar from the first cesarean. She had no idea how this happened, but there was, in fact, a missing ovary between the 2 births. Now, we can speculate as to why the aliens may need to take an ovary. I don't really know. We can speculate. Again, all miracles and no theology. But to try to guess at the theology or the mystique behind this, the purpose, obviously, there are many, many ova in that ovary. As you know, a woman is born with all the ova she will ever have, right there. So there's a kind of a, if you want to speed up the process of ova harvesting, maybe that's the way you go about it. Now, that's that particular case. We're now going into some other cases which are a little more upsetting. What I would like to do is to have enough time, I think we will have enough time, that we can have some questions at the end. There are lots of things people have asked me since I've been here about these cases, and I would like to have discussion, and maybe there's somebody in the audience that might have some suggestion as to why some of these things take place. But this is a very, very disturbing case now. And this is a case that my friends and quite wonderful researchers, Rob and Sue Swiatek, have uncovered. It came to them because of their position in MUFON, actually, and the Fund for UFO Research, from someone in the, let's say, the general Washington, D.C. area. And this is Sue's email to me. She said, on the 7th of October, 2003, a young man contacted me through the MUFON website, as I'm listed there as Virginia State Director. And incidentally, I asked Rob and Sue if I had their permission to talk about this case, since this is essentially their case, even though I have interviewed the subject by telephone. He opened by saying, "I would like to talk to you about a weird experience. I don't want sympathy or any recognition for what I need to talk to you about." He went on to say, "I was on a table and 3 people were standing over me. There was a machine stretched over me about halfway down my chest, just across the top of my stomach. A series of bright flashes were coming out of the machine. I only felt a slight warm sensation across my chest and the top of my stomach. To be honest, it felt good, actually. Then one, I will say person, looked down at me and just said, 'I'm so sorry, but we hurt you.' I could not respond at all or move. Then, to be honest, they looked as if they were puzzled and at the same time hurt that I was so hurt. Then very softly, I guess spoke and told me, 'We will always try to help you and we will never forget you.'" Fairly ominous statement. In subsequent conversations, the witness clarified the odd expression, "One, I will say person, looked down at me," to mean that the beings looking down on him could not easily pass for ordinary people. They were of normal human height, but had extremely olive-colored skin, long blonde hair, and large ice blue eyes. This is a very typical description that we get of beings which seem to be transgenic, as if there are human and alien features intermixed, although we don't know, of course. He also clarified, this individual, the expression, "Then very softly, I guess, spoke and told me," by saying that the beings didn't really speak per se. It was all telepathic. 2 weeks later, he was in the hospital with sharp chest pains. Fluid was gathering around his heart and putting pressure on a valve. The fluid had drained from his lungs, which had been recently severely traumatized. He had a chest x-ray at the hospital, He had had a chest x-ray at the hospital the previous year, and there was no lung damage. Now his lungs showed severe, sudden burning. The doctors kept asking him if he had inhaled a caustic chemical or inhaled hot fumes from a fire. He said no. This young man had this experience in March 2000 when he was 30 years old. He has the lungs now of a very old man. Now at 33, he is on oxygen at night and has been told that he needs to think quickly about a double lung transplant. His doctors located in a relatively small town wanted him to see some people at the University of Virginia Medical School. He went there on Thursday, set a date. He called to tell me that these new doctors were very curious and kept asking him if he'd been near radiation, if he had had access to uranium. He kept saying no. He had some very simple job, and I've forgotten now what it was. He kept saying no. They were of the mindset that his injuries were not even consistent with the inhalation of a chemical. They said the top of his lungs were burned so badly they are blistered, and the rest of the damage is so symmetrical it looks artificial or mechanically induced. Inhalation damage would not be so pristinely symmetrical. They speculated upon radiation or microwave-like cooking of the lungs from the inside out. There are many inquiries about uranium made him nervous, and in these tense times made him feel intimidated that they might paint him as some kind of terrorist. They recommended a lung transplant sooner rather than later. I know, Sue wrote, that we can do nothing for this man medically, but if he gets his transplant, he wants to donate his lungs to a UFO group that can preserve and look at the evidence. This is an offbeat offer request, but we need to know what we can do. I hope you can think of something to at least get this case into record. This man received nearly yearly chest x-rays because he was prone to bronchitis in the winter. These x-rays attest to the fact of the sudden onset of this condition. I'm hoping we can get some cooperation from the doctors. This man is terrified. Now, there are various things that can be said about this. Of course, I'm sure all of you know about the wonderful work that John Schuessler has done with the Cash-Landrum case, and the very, very clear evidence there that Betty Cash and Vicki Landrum suffered some kind of radiation poisoning, hair dropping out, all kinds of burns, and then ultimately the onset of some forms of cancer. I have to say that in all these UFO reports, we very, very rarely get something that seems to imply a radiation problem. People are abducted every day, all the time. Probably right now in Denver, somebody is going up the chute into a craft. I hope nobody from this room. Look at the person next to you to make sure it's... But at any rate, it happens frequently, but we don't get radiation poisoning. The Cash-Landrum case that John has written about so eloquently and lovingly, really, I have to say, is one real exception. But these doctors here are suggesting that possibility. Now, we have absolutely no way to know or even to guess what was done to this man. He remembers these figures over him. I had a fairly long conversation with him on the phone, and this man is gasping. He has oxygen at 33. And he described this as maybe a dream or dreamlike experience, but very, very, very real. He was reluctant to tie this to the UFO phenomenon. These are not people who say, look, hooray, I've had some terrible thing happen. That's good evidence. They don't want to connect it at all. There must be an explanation. I can be healed somehow. But in this case, this man is coming to that conclusion, quite obviously by the things he said, that there was something done to him. Now, again, in terms of what happens during abductions, I've said many, many times the patterns are very similar from case to case. There are all these anomalous anomalies that turn up where something different happens. Like Kelly Cahill having this thing, this mark around her ankle with the other people, as if she was bound somehow. Very, very rare. One thing that seems to never happen is that there is any kind of alien interest in the lungs, the cardiovascular system, the respiratory system. They don't seem to care about that. They're interested in the reproductive system, and they're interested in the central nervous system, centrally. We don't know what in the world they were doing with this man's lungs, but apparently, whatever it was, it didn't work. Now, the idea of symmetry is very important here, because both lungs were equally affected in exactly the same way. And this is extraordinarily rare, the medical people tell us. I have a case now where a man has written to me, and I'll be looking into this case later. I intend to see this man that Sue and Rob have worked with. I'm very anxious to interview him in person and so on. But in this particular case, a man has written to me, an older man in his late 60s, number of missing time experiences. One quite wonderful thing is he was driving home from work with 3 or 4 people in the car, and they all saw this light, and the next thing he knows, he's in bed at home in his clothes. All his clothes are on. No idea how he got there. At any rate, many other things. But this man said, all of a sudden, after one of these experiences, he began to develop, very suddenly, cataracts in both eyes simultaneously. And they went from the center outwards. Now, cataracts tend to develop more on one side than the other. I can proudly attest to that, having had one lens done a few years ago because of a cataract. Now I've got another one I have to worry about on the other eye. These things are always a little asymmetrical. And they also usually start from the side and move across the eye, but not from the center outwards. The doctor, the ophthalmologist who dealt with him, was very puzzled by this. The symmetry shouldn't have happened. And the doctor asked him, in a very similar way to what the doctor asked this man about the lungs, he said, have you been staring intensely into ultraviolet light? Everyone is looking for some kind of physical cause, and nothing turns up. But what we have, and I want to remind you again and again, these are medical anomalies, medical mysteries. It isn't just somebody comes down with a stomachache or a high fever and you can say, well, it's connected with the UFO phenomenon. Those are worthless in terms of any kind of evidence of anything. But these are not worthless. These are extraordinarily important, unique circumstances that require investigation. What we don't really know with this man with the lung problem is how much time he has, whether a double lung transplant will come in time, what he can remember about the experience, and so on. And it's a case that is poised for very, very serious investigation, but we need medical help to look into it. Now, the last case I'm going to present, and then we're going to be, I'll give you some other quick things that have happened, medical things, and then we're going to have some time for questions, I hope. A man wrote me a number of years ago. This is a very, very intelligent man, and this is the letter. He said, I hope, the initial letter, I hope you can provide me with some guidance. There's a pattern of events in my life indicative of the kind of abductions chronicled in your books. I'm not sure myself what all this means, and I'm frankly concerned that my imagination may be running overtime. Everybody who writes me tends to put himself, herself down in just that same way. Maybe it's my fault. I may be making this up. The fact that these same things have happened to my brother and my sister prompt me to write. I've not discussed these issues in this context with either of my siblings, not only this topic, but the physical and extremely personal nature of the symptoms makes this entire subject a bit difficult to discuss. To keep this letter brief, I will enclose details. Now, I'm going to read some of this. It's not terribly pleasant, but it's very touching to me. Now, I worked with this man. We did 3 hypnotic sessions. He strikes me as a totally honest and quite despairing young man. He says, I'm 43 years old and have been living in New York City a number of years. He describes what he does for a living, which is a very creative business, which I won't go into. He has a master's degree, etc. Oldest of 3 children. My brother and sister still reside in the same town that I grew up in the Middle West. They're each married. Talks about the children. Now, he says, and I will read some of this. He said, about 6 months ago, I did some work for a particular employer, which required me to spend time outside New York City in a particularly desolate location in Pennsylvania. I stayed in a desolate guest house. During my first stay, I recall being taken in the middle of the night by bright lights, being awakened by bright lights shining in from the outside. I suppose there was some sort of outdoor lighting I hadn't noticed before. This happened twice during the first week. On subsequent visits, I found there was no outdoor lighting or no explanation for the lights. They appeared one more time, and I have only a vague memory of trying to scream and forcing myself to wake up. Following this, a variety of rashes and warts developed on my body, particularly around my genitals. I had several small marks I suppose were bug bites of some sort, and had to deal with recurring bouts of diarrhea. I suspected some kind of social disease, in quotes, despite the fact that I had not been sexually active. The medical tests proved negative. A course of antibiotics helped the diarrhea and nausea, but for a short time, but they returned. The rashes were diagnosed as sun damage, despite the fact that it was the middle of the winter and I hadn't got any sun, particularly on my genitals. Creams and ointments prescribed by the doctors only made the problem worse. At the same time, I began having trouble with night terrors. I was having a great deal of trouble falling asleep at night and would wake up bathed in sweat. Some irrational fear was overwhelming me. Attempts to examine the fear only produced a don't go there kind of warning. I'm fairly skeptical and cynical by nature and don't have much faith in the notion of repressed memories. So I found the sensation puzzling and peculiar. It was literally like a force in my mind pushing me away from something. Then he goes into some early odd experiences when I was a child, he says. Incidents that happened, and this is one of these extremely subtle little things that on the surface means nothing. But when you examine it and examine the way it's been clung to by the individual, you have to take it seriously, something that should be looked into. He said one case stands out of my mind. My grandmother took my sister and me to see Pinocchio one night. The drive home was eerie and sticks in my mind. Years later, when my sister and I both mentioned we'd never seen Pinocchio, our mother contradicted us and said our grandmother had taken us. She remembered because we got back very late. I still can't remember seeing the movie, but have memories of the creepy, never-ending drive home. He goes into another case, which is very similar, where there's that ominous feeling, something happened, he should have remembered the movie, etc., that kind of thing. And he talked about the night terrors. He said the feeling is somewhat irrational, a bit like a child's fear of monsters under the bed. It is simply an overwhelming dread that defies examination. I'll be exhausted yet unable to sleep at night. Sleeping pills won't help, and the problem doesn't seem to be associated with real-life worries or anxieties. The anxiety simply seems to be about sleeping at night. Now, for the main problem. And, you know, this might seem unnerving or funny or something, but it isn't to this man. He said, in February of 1985, about a month after my missing time episode, one of the ones he had alluded to, my right testicle shrunk to the size of a pea. I went to several doctors about the condition, which puzzled me apparently, and apparently it puzzled them. They noted the small size of my right testicle, but because testicles don't just shrink without a notable incident or amount of pain, they dismissed the condition and the problem. They said it didn't exist. 5 different urologists gave me the same opinion. At first, I suspected, and this man is gay, at first I suspected some AIDS-related disease or condition, in spite of the fact that I was and remain HIV negative, am not promiscuous, and practice safe sex. That fall, I began graduate school at a major university. Because the condition was affecting my work in a negative way, I began seeing a therapist. After 4 frustrating months, the therapist conducted a simple test that proved the testicle had died. A quick phone call changed the urologist's opinion overnight, and I was rushed into surgery. I should note that the urologist did not do this test because they thought without pain or an incident, there could not have been this condition. My therapist, who was also an MD, is an important person in his own field, which I will not go into. The testicle was found dead and removed. No cause could be determined. Later, a recurring infection was detected in my urine, and later still I recalled surgery to remove growths in my urethra. The cause remained a mystery. There was nothing in the textbooks to explain what was happening. Now, and there's more to this. Now, the point about this is the doctors assured him that the only way a testicle could, the gland itself, could atrophy like this would be if it was deprived of blood or any kind of nutrients from the rest of the body, which would cause inevitably enormous pain. And that's why they said this can't happen. Well, here's a man who suffered through this. He's had many, many things happen to him in other areas. And you can imagine, especially us men, the horror of this and the fear and what is going to happen next. Again, we don't know how this happened, why, but it is totally a medical mystery because it just can't happen, as the 5 urologists attested. Now, again, this is the kind of thing that requires us to say, we need some medical expertise to interview these people, to look at the medical records. And I should go back to the lung case that I just described that Sue and Rob Swiatek looked into. And Sue has told me that this man has a practically 2-inch stack of medical reports on the condition of his lungs, the tests that were done, the degeneration of the lungs themselves, and so forth. There's plenty of material here. This isn't something that just you hear about it. These are things which leave all kinds of medical artifacts behind, medical records. Now, I'll just give you a couple very quick things just as a rundown. I have a number of cases where men describe, in one case a woman, severe and sudden bleeding from the bladder. Now this we know, I know this because I had this condition myself, and the urologist told me there are only 2 causes, a severe infection or a tumor. In my case, it was a tumor. That's why I only have 1 kidney. And I have to say, when I went in for a routine CAT scan a number of years later, a very sleepy technician who took the pictures and carried the films back came up to me nervously and said, "Mr. Hopkins, do you know you have only 1 kidney?" And I went, "What?" But at any rate, one of my cases, a man who was a teenager, 15 or 16, living in Tel Aviv. After an experience, each one of these memories is also very interesting and colorful, but we don't have really time to go into them. But he thought, incidentally, that the Israeli secret police were coming into his room at night, this particular incident. At any rate, he had sudden bleeding from the bladder, and his father was a surgeon, and he was taken to the hospital where he spent something like 4 or 5 days. They did a cystoscopy, which means sending a viewing tube in the urethra to see the condition of the bladder. There was some abrasion, but no tumor and no infection. And the doctors had no idea why this would happen. It has happened to other people. It has happened to a medical doctor who is a friend of mine. He described this happening to him when he was a young intern. Total mystery. These are not just casual things. Bleeding from the bladder is a rather extreme and dangerous symptom. That is just to give you one particular case now of that situation, but I have several others. Now, in terms of the mutilation that can happen sometimes, a woman that I worked with had an experience outside the window where she was sleeping, filled with light, a lot of fear, confusion. When she awoke in the morning, she had felt a kind of itching in her genitals, but did not look. And she said in her mind, it was as if she was sort of telling herself, don't worry about it, it's fine, just go about your day. Don't look. This happened the second day, and the same time when she woke up, there was this sort of uncomfortable itching and so forth. And finally, she went to her gynecologist, who said one of the inner labia had been sliced off. It was gone, neatly sliced. And I've talked to a doctor involved in this particular case. No explanation. I have some photographs of a woman who, taken by her gynecologist, who had 2 or 3 perfectly round holes punched in the labia. There was no bleeding. This had to do with an abduction experience. Those tissues are, as you know, very well supplied with blood vessels. There should have been blood all over the place. It wasn't in either case. What are they doing? Why? We do not know. But we have here what I regard as very, very serious, telling physical evidence that these are not people's imaginations or stories or whatnot. They leave behind them physical traces, which are visible, medical anomalies which have really a great deal of mystery about them. And we need to look into these very, very seriously. We need medical help.